The information provided in this podcast episode is for entertainment purposes and is not medical advice. If you have any questions about your health, contact a medical professional. This content is strictly the opinions of Lucas Owen and is for informational and entertainment purposes only. The references, claims, and scientific information linked to any products are only applicable to those listeners who are based in the US. If you are outside the US, this information does not apply to you. It is not intended to provide medical advice or to take the place of medical advice or treatment from a personal physician. All viewers of this content are advised to consult with their doctors or qualified health professionals regarding specific health questions. Thank you for listening to the Boost Your Biology podcast. My name is Lucas Owen. I uncover the most cutting-edge health information on the planet, ranging from hormones, nutrition, supplementation, fat loss, biohacking, longevity, wellness, and a whole lot more. Welcome to the Boost Your Biology podcast. What's up, ladies and gentlemen? Welcome back to the Boost Your Biology podcast. Today, I have a very special guest joining me in the studio. This guy is officially the world's greatest supplement formulator. He's an international speaker, author, educator, and an expert in the field of health optimization. He has also been mentoring me over the last, let's say, 3 to 4 years, of which I've been so incredibly grateful for and have learned so much. In fact, a lot of the content that you see me post online, a lot of that has been actually inspired by this man. So, Shawn Wells, we are here in the studio. Welcome back to the show.
Thank you, Lucas. I appreciate that. I really, those words mean a lot because I feel like if you're going to teach, you need to be a good learner and vice versa. And a lot of the people that I've mentored through the years have mentored me in different ways. Like, you know, it's that kind of thing like where if you don't stay up on things and kind of new techniques and new approaches, then you'll never stay like relevant with the way things are working. So I look at your content. I look at the things you're doing as well. Like you inspire me as well. And it's a give and take. So I really appreciate you saying that.
No, I love that, man. And my hopes are that in the future, I do the same thing to the guy below me. Like I want to
100%.
just pass it on. So yeah, massive respect for what you do. But for my listeners, there's going to be because there's a lot of new listeners since you last came on the previous podcast.
Yeah.
Let them know a little bit about yourself. I mean, your journey is very, interesting. So do you want to just share that with them?
Yeah, I've been through a lot. I had a very difficult childhood that, there was a lot of trauma. There was bullying. There was depression, suicidal thoughts. It led to disordered eating and body dysmorphia. It led to me gaslighting myself, abusing myself, imposter syndrome, insecurity. That led to, kind of like the body holds the score. That led to autoimmune conditions, Epstein-Barr virus, fibromyalgia, chronic fatigue syndrome, Hashimoto's. I was in bed for 6 months. I ended up getting brain tumors later on. I've had discs replaced in my neck, a number of surgeries throughout my body, probably 20 different surgeries, because I was just dysfunctional. I was just pushing myself relentlessly. I mean, people talk about working a lot, but I was literally pushing like 100 plus hours a week and, doing all kinds of substances to make that happen. A lot of the biohacking that I learned was just me learning how to push myself further and do it with even less sleep. And, that isn't the healthiest way to like biohack. And that's why I like the term now of like health optimization, because it feels more balanced. It feels like, a balanced masculine, feminine approach. Like I love the technology, the kind of masculine, like, of like peptides and hormones and biologics and, V cells and, all these things. Cool. And we also need to do grounding, to play, to dance, to connect, to hug, to journal, to pray, to like do a float tank, to, do grounding and, do sun gazing and forest bathing and all these things that we've learned along the way that are like really important for our holistic health. And so I love that biohacking, or maybe health optimization, is now kind of encapsulating that feminine and masculine, that kind of future and the past, and bringing those together in a really beautiful way. And that's really where I've landed. And that was after I did a really pivotal plant medicine journey just prior to COVID, heading into 2020, that shifted everything for me. I was able to really pivot out of a lot of my depression and suicidal thoughts and insecurity and imposter syndrome and kind of grinding myself to death. If I wasn't going to commit suicide directly, I was going to commit it indirectly, just through work and just beating myself to death. And so, where I've come during this period of time is now I feel like I truly love myself and I'm enjoying life and I'm enjoying people around me. Prior to that, I used to think that love was very conditional. I used to think that it was all about achievement, that people wouldn't like me unless I showed my value to them. And like the second I would get on, Ben Greenfield, I needed to be on Joe Rogan, or, it's just nothing that I ever did was ever enough. I never enjoyed the things along the way. I never enjoyed the journey. It was always about, how do I get to the next thing to prove myself? So I was never loving or kind to myself. And, luckily that shifted. And now that I know all the biohacks, I can build on a solid foundation. And that's really the beautiful combination. And I would encourage, there's a lot of people that I see biohacking that are in that space that I was in. Some of them are very popular biohackers, but I would say that it's really important. And I say that with no negative to them, whoever they are, but it's really important to build on a solid foundation. Like the biohacks aren't going to do a thing. I mean, when we look at like the blue zones, and I'm going off on a rant a little bit here, when we look at the blue zones and we look at these super centenarians, they're not doing like stem cells and V cells and drinking their urine and, like doing like a BPC 157 and, all this stuff. They're methylene blue IVs. And you know what they're doing? They're like connecting. They're near the ocean typically. They have purpose, like that ikigai, like they know like what their value is in the world, like true value. They connect like with family and friends and a tight community, and they often have these 2-3 hour dinners, and they eat fresh food and they slow down, and they live over 100. And a lot of these people that are doing all these crazy biohacks aren't even making it to 80. So I really feel like, yes, there's a place for these biohacks, but we need to take care of ourselves and understand, what it means to be human and value on this planet in the meantime.
Yeah, I fully agree with a lot of what you said there, particularly like the newcomers or the rookies to biohacking. A lot of the time they're jumping into it, but they're completely like forgetting about what it means to be human.
Right.
And you have probably noticed that yourself with the human connection, and like you have facilitated groups. You've traveled the world, consistently in the last 6 to 12 months, just running talks and being an expert speaker at these events. And you've probably realized that shit, like there's a lot of people that are in this biohacking space that are actually like miserable, like internally.
Totally. And that makes me so sad because I was one of those people that I was blessed. I had a platform. I thought I was doing good for a lot of people, but I wasn't taking care of myself, you know?
Mm,
And, I was living with a lot of pain. And there's a lot of people in that space right now. I mean, loneliness to me is the number one killer. That's the ultimate pandemic
mm,
that's spreading across this globe is loneliness. If you have connection to nature, connection to God, connection to friends, connection to family, connection to pets and animals, you will not be lonely and you will have a very wealthy life. It's not
mm,
about money. It's not about thousands of likes or followers. It's about deep connection to those things that are around you. And if you
mm,
look at the way that we get controlled, it's through isolation and it's through separation.
mm. Yeah, no, definitely, definitely. So maybe Shawn, I mean, speaking about your career and your journey, I mean, you've overcome an enormous amount of adversity and, you've had to develop a lot of resilience. Um, Maybe talk us through some of the opposites to that, which are like the key highlights or the moments that were like that brought you so much joy and fulfillment.
Yes. Bro, so like the first time I did a formula that made its way onto bodybuilding.com, it was called Ultima. It was a pre-workout that was insane. It was like it was like close to $30 in raw costs. And so the
Gee.
guy I was working with made like $6 or something on it. I mean, it was just terrible. Like not the smartest thing, but it was my first product. It was amazing. Everyone loved it, of course. And it was when I was on bodybuilding.com forums and it was just so exciting to see my product in the wild and then see like reviews of people using it and getting feedback on it and just to see it for sale was beautiful. And then similarly, when I was at Dymatize, when I was taking over for them at product development, uh, when I saw like my product in a GNC and just like that was like I can't even tell you like it's like when I hear singers like these bands or whatever like top pop singers talk about hearing their song on the radio for the first time. It's like that kind of feeling. And I
Mm,
remember with one of my protein products and I think one of the pre-workouts when I was with Dymatize, like I won like a bodybuilding.com award. I got to go on stage and it
wow.
was just the coolest. Like I'm like living my dream. There was another one. This was really cool and this is not cliche at all. I was in a room interviewing for Dymatize. They interviewed me for about 6 months because they were interviewing like all kinds of people from all over the world. They had private equity funding. Dr. Rob Wildman ended up becoming my mentor and actually taking the job that I was interviewing for. But because they liked me so much, they hired me as well and kind of hired me like just underneath him. So he was the CSO and I got to be the director of R&D. And it turned out to be a massive blessing because I got incredible mentorship through him, similar to what you're talking about, but much deeper. And it was just
Mm,
profound for my career. But I remember interviewing in this room. It was one of their boardrooms, and they had hundreds of products. Dymatize, literally through the years, they had been around for 20 plus years. They had hundreds of products, similar to like an Optimum Nutrition. And
yeah.
I'm like in this room, and this guy's interviewing me, and I'm looking around at all these products, and it's like being in a GNC almost. As I'm like looking around, I'm like, what? And like I just thought about like what it would mean to actually work here because up until that point I was chief clinical dietitian, but I was working in hospitals and nursing homes and my dream was to work in
Yeah.
supplements. And that's where like, we've talked that like I'm glad that I can mentor you. I'm glad that there is Instagram. I'm glad that there are supplement formulators. When I was coming up, there was none of that stuff. And like the road was long for me to get here.
Mm.
And it's a blessing that it's faster for you. It's certainly not easy, as you know, but it is faster potentially. Anyway, this guy's interviewing me. His name was Tim Batterson. He ended up becoming the COO. And he was asking me about like what it would mean to, be here. And then he said, "What would you change if you could go back?" And I said this, and I mean this in truth, and it's going to sound cliche. I'm like, absolutely nothing. I am here right now. This is my dream to be here. I worked my whole life to be in this room right now. I'm looking around. I actually got up and picked up products. I'm like, this is incredible. Like this is what I want to do with my life. I would absolutely change nothing. And you heard all the crap that I've been through. I would change nothing because everything led to me being there. And I got the job. Like they saw my passion. They didn't even have a position for me. They're like, we need to hire this guy. So
Wow.
like that was the start of my true career, like full time working in supplements and me like starting to live out my dream.
And that was whilst you were still working in like, that was whilst you're working your regular, like 9 to 5 job. And that was like the pivotal moment where you were able to like step really into that space. And then what happened after that? Like after, you're with Dymatize.
I literally, no exaggeration, was working like 80 to 110 hours a week. And that's real numbers. I would
Jeez.
get there at 6 in the morning. I would leave after 11 at night, sometimes midnight, and I would work on Saturday and Sunday. I did that for 3 years because we were heading towards sale. The desire was to flip the company to a strategic, and we did to Post for 425 million. But I treated it like getting my doctorate, getting like a PhD or an MD. Like the thing is, like those are cool, but like I was literally surrounded by titans in the industry I wanted to be in. The last
Mm,
thing I'm going to do is just go home every night.
exactly.
I got to speak to all these guys. So what happened is like at 5 o'clock when I was done with my work, I would go around to all the other C-level people, the CEO, the VP of sales, to the COO. I would ask if I could take on projects for them, if I could help them with things. I would like talk to them for an hour. Sometimes I would go out to dinner with them and then come back just so I could connect with them, learn from them. And I ended up doing so much stuff for everyone that whenever they had their C-suite meetings, they would invite me because
Mm.
they kept saying like, well, who knows the answer? And they'd always say, well, Shawn does. And they're like, well, we need to start inviting Shawn. And I was a director level person. I was literally the only director level person that got invited to these meetings. And everyone said that I was like the most pivotal person to the sale. And I won Employee of the Year 3 years in a row. And,
Mm.
and it was a massive global company that was in 70 plus countries. And I got to make my mark. And then I also knew that if I could successfully help take a company to sale, that everyone would want me. And that's what happened. Like everyone came out of the woodwork to get me. I ended up going with BioTrust, but like Nutrabolt, which is Cellucor, made an incredible offer for me. Bodybuilding.com, a bunch of companies did. So it all worked out.
It's incredible. And I'd imagine like when you were stepping foot into that space, you were probably like, were you thinking deep down that you wanted to be in this space for like 20, 30, 40 years ahead? Like you wanted to,
The rest of
mm,
my life. This is
yeah.
what I wanted to do with my life. When I was at Babson getting my business degree, and I ended up losing a bunch of weight, and I was very heavy prior to that, and I started working out and using supplements and seeing this massive change. Creatine had just came out from EAS, and I was reading Muscle Media 2000 and this supplement encyclopedia and all this kind of stuff. It was super cool. And I ended up going to my doctor, and I thought he was going to like tell me all this stuff is stupid because this is 25 years ago or whatever it is. And he looked at me, you could tell how passionate I was, saw like all the changes in me. He drew out a lifeline for me between 20 and 80, and he said, why not be happy between here and here? And it just blew my mind. That guy made the world's greatest formulator. There would be no Shawn Wells as you know it, not even 1/100th of what I've accomplished, had that man not said that to me. Because up until that point, I believe that, you have to do business. There wasn't Instagram, there wasn't Oprah's, and I don't know, Tony Robbins and all these people. Like, there wasn't people telling you go chase your dreams, be whatever you want. I was always told, be realistic, go make
Mm.
money, be serious with your life. And this guy who is a medical doctor who I respected, at that time in my life, that was like the highest level of authority. And I was like, I can just do what I love. I could just do that. And then at that point, it changed everything. And I just became like a man on fire to just make that my career.
Geez, it scares me how much similarity, like in terms of the way that I think as well, Shawn, in terms of for the rest of my life and having that level of impact. And I look at it in the sort of same light where I'm like, I know that I've got talent to share and showcase, and I would be doing the world a disservice if I didn't bring these ideas to market. I feel
Agreed.
this, and I'm sure you felt the exact same way.
Agreed. I love that.
Oh man. Yeah. So that entire journey there, when did you first get into like the idea to bring a brand new ingredient to market? At what stage in your career were you at when you decided that?
There was two earlier on that I didn't make money from or get credit from. The first was raspberry ketones, and I put it in a product for Man. It's a bodybuilding supplement, sports nutrition company, Man. It stands for like metabolic augmenting nutrition or something. I don't know what it is, but I was working with them and I was formulating a product called Scorch, and it was their fat burner. And I came up with the idea of doing raspberry ketones. Ended up seeing it a year later in about 300 products. 3 years later, Dr. Oz mentioned it, and there was about 1,000 products, and it made probably hundreds of millions of dollars, and I made $0 of it. So that was like a lesson that was like, oh God, I need to figure this out and do a lot better. And then there was one other ingredient, but I think like the biggest turning point while I was at Dymatize, I started working on TeaCrine, and I started working with a guy I was sourcing ingredients with in China at the time, Kai Lin from NNB, who you've met.
Mm-hmm.
And I have a, I don't know, 10+ year relationship with him, and it's been incredible. And we've created so many ingredients together. And I ended up reaching out to Dr. Hector Lopez, who's passed on, unfortunately, and Dr. Tim Ziegenfuss. And then after we kind of built out a team, we ended up taking it to Matt Titlow of Compound Solutions. And then shortly thereafter, we came up with methylliberine and called it Dynamine. And, those ingredients obviously made a lot of impact. And I've just been rolling ever since.
Maybe I think because there's going to be a lot of people listening to this podcast, they'll have no idea the sort of the breadth and the variety of ingredients that you have, like at least contributed to or pioneered. Do you want to just do a full scope? Because they're going to be blown away, like honestly blown away by the sort of ingredients we're talking about here.
Yeah, I mean, it started early on with my partner at Man, Joey Rodriguez. I had worked on actually bringing beta-alanine, citrulline malate, orotic acid, sesamin,
Gee.
like I said, raspberry ketones. But then after that, it was this verbascicide, echinocoside,
Wow.
then TeaCrine, Dynamine, worked on ketone salts first to bring those to market, and then including the active isomer and the free acid and the fermented versions. Um, then it's just a bunch like dihydroberberine,
Mm.
ergothioneine, L-beta. Uh, there's, there's a lot. There's a lot that didn't come out. So, but like, um, lately it's been paraxanthine, as you know, which is branded as Infinity, dileucine, which is newly released and very hot, as you know. Um,
Mm.
Gosh, I don't know. I can't even remember all the things. There's I said ergothioneine. I don't know. You probably know a bunch. I helped bring
Yeah.
Grains of Paradise and standardized it to the six paradol. Um,
Mm.
there's been a bunch. Dehydrozingerone, tetrahydrocurcumin, a lot of things. But yeah.
Well, let's talk about I mean, you mentioned as well, like obviously there's so many just discussed there, but there were ones that were like that never actually made it to market, but you spent an enormous amount of time on.
Yeah.
Do you want to share with my listeners, like, because that's a lengthy process. We went through that together,
Hmm.
so I know how in depth it is to like actually, like, first of all, validate it. Is it feasible? Does it tick this box, this box, this box, this
Yeah.
box? So sort of walk us through that process.
Yeah, it is a lengthy process. You're right. Like with paraxanthine and dileucine, where we're doing everything right and where there's a lot more boxes to check if you want this to be a long-term ingredient where 20-year patents hold up. First off, you got to keep your mouth shut, file a ton of patents. And typically I do like either kind of like alpha level work with humans and like animal level work. Uh, Typically doing this through India to get the work done, and then we can file patents on that work, and then we will do a much deeper dive from there once the patent has been filed and it's pending. Then we'll start the human trials, going. But along the way, like you said, we have to look at whether it's feasible in terms of manufacturing. We have to see if there's issues with stability, organoleptic issues, solubility, whether it's hygroscopic, whether you can standardize it to something and truly test it for that, whether there's solvents that are potentially toxic, or whether you're doing it by fermentation or whatever the methods are. There's so much complexity there, and then figuring out what that optimal serving size is. Does that serving size then translate into a feasible cost per dose efficaciously? I mean, there's so many pieces, and then there's all the regulatory stuff, just getting it into, as you know, TGA in Australia, there's FDA in America, and there's EFSA in Europe, and all the different things that Health Canada, like we have to go through in all these different markets. Everything's different. And we have to do
Mm.
trademarking in every market, where we're trying to protect our name across the globe, because there's places that will just steal your name, steal your ingredients. And then that's what happens the whole time too. If we're not trying to lock in the supply of our ingredient and create it ourselves, if you rely on another manufacturer in China, quite often either they'll steal it and sell it, or someone else hears about it that worked there and then starts working on it too. And then you got 10 places you're competing with, and good luck sending out a cease and desist with Chinese manufacturers. It means nothing to them because that's American law and it's not going to hold up. So this is really difficult. Like, for example, with both paraxanthine and
Is it TeaCrine?
dileucine. Yeah, well, yeah, with paraxanthine and dileucine, kind of my most recent efforts, we did It's at least 3 years before it's even close to commercialization,
Wow.
maybe as much as four. And then, I mean, so that's a long time to go without selling it and making money, and you're sinking money. And it's anywhere from like 2.5 to $5 million per ingredient. So
Gee.
that's a lot. That's a lot of effort. Like, I'm blessed to have like a team of people around me. I come up with the ideas, but like that's only one component, like you need someone like my partner Kai Lin that has the manufacturing capability and the huge scientific team and the GMP factories and all the things. And then I have people helping, like Dr. Ralph Yeager that are doing like the study design, Dr. Martin Perpero that are doing all the regulatory work and patent filing. And there's a lot of pieces, and I'm only good at so many things, and I only have so much bandwidth. So I have to
Mm.
rely on a number of people. And then of course there's the marketing and sales once you finish it up, right? So that's the next component. Like with paraxanthine, working with TSI as the global distributor. With dileucine right now, it's going to be with NNB. You know, Tributyrin and Rodeo Prime, like Nutriscience, are taking those on to some degree. Like Butyrogen is a mixture of our Tributyrin plus like sun fiber. As I said, TeaCrine and Dynamine are with Matt Titlow Compound Solutions. So there's a lot of places these things go,
Mm.
um, and it's just been an amazing process.
What about Sean in terms of like product categories? I mean, the energy optimization space is, I mean, I personally have seen it time and time again. The number one complaint that I get as like a health coach
Yeah.
is like lack of energy. What are the product categories that like have always excited you the most, or you think are going to be in hot demand in the future?
What excites me the most is not always equivalent. What excites me the most is probably mitochondrial health, and it correlates to, like, when you look at chronological versus biological aging, it comes down to mitochondrial and ultimately metabolic health. And 87% of Americans are metabolically dysfunctional and are in a state of insufficient cellular energy, ICE, where they're not making enough ATP, enough of that energy currency to run the body, and they're getting hypotonic muscle or hypertonic muscles, sorry, and they're getting chronic fatigue syndrome and fibromyalgia and brain fog and all of these things because they're just not running optimally. And it's really putting us in a situation where you're seeing disease rates ramp up because about 99% of disease is correlated to metabolic slash mitochondrial health. They're not genetic in nature, they're metabolic in nature. And so for me, I think the key to longevity is beyond like purpose and contentment and happiness and connection is mitochondrial health. All that said, I do realize what moves the needle are things that are experiential. And what I
Mm.
prioritize in terms of the ingredients I'm working on so that I can work on other ingredients that are mitochondrial or anti-aging in nature are the ones that are experiential. And paraxanthine, TeaCrine, Dynamine, these ingredients are truly experiential where you feel them the first
Yeah.
time, and you're not like taking it and saying like, like that bottle of CoQ10 that like, is half taken and sits in the back of the cupboard, and you're like, I don't know, you know, they might take some, but a week later they're like, I don't know. So like I didn't want to put ourselves in a situation like that where we have to educate the consumer and where they're not experiencing it. So that's what moved the needle, is energy. Ultimately,
Mm.
energy I knew was like the biggest thing, as you said. I mean, that's what my book's named, the energy formula. and I've lived much of my life without energy, so I understand what that's like. And I do not do well with caffeine. I'm a poor metabolizer of caffeine, so that led to a lot of my passion around finding these other
Mm.
molecules.
At the point in which you know, understood the importance and significance of mitochondrial function, what were some of the common ingredients? Because I know, like, when I was working in my dad's pharmacy years ago,
Mhm.
all I could really recommend was like exactly what you said: coenzyme Q10. We had acetyl L-carnitine. We had like B vitamins to a degree. But
Mhm.
like, do you want to sort of, yeah, elaborate on that?
Yeah, I think, that's great that, you can talk about like the electron transport chain and CoQ10, as you mentioned, and PQQ is kind of a sister molecule. Um, I think when you look at CoQ10, you might want to look at ubiquinol, especially if you're over
Mm.
40. Maybe MitoQ, that's really an interesting one. With PQQ, I do like the fermented version, and I think you have to take a higher dose. Like I
Mm.
really think like 40 milligrams is kind of where you start moving the needle more. Like a lot of these products are too low dose. It's an expensive ingredient. I also look at things like, well, metabolically, it's going to be important. As I said, the metabolic dysfunction. I think you need to also address glycation, inflammation, oxidation. So this is where the dihydroberberine comes in, as it's going to enhance GLUT4 translocation. It's going to be an AMPK activator. It's going to be a GLP-1 agonist, which is really, the kind of the hot thing right now to speak about. But it's going to lower insulin. It's going to lower blood glucose transiently and long term if you were to look at like hemoglobin A1C. But if you look at the data around something like, whether you're looking at, berberine, dihydroberberine, cinnamon, semaglutide, metformin, Ozempic, whatever you're looking at, you also tend to see inflammation go down, like CRP. You also see dyslipidemia improve, not CRP, lipoprotein A improve. All of these kinds of things improve because of that whole milieu that I'm speaking to. And so addressing all of that can help. And by the way, with dihydroberberine and berberine, we believe that there's a bit of like hormetic stress happening to the mitochondria, where, some people like were concerned, like, oh, is it like maybe it's not good for the mitochondria? It's actually seems to help with mitochondrial biogenesis. So we think there's like a little bit of like hormetic stress, mitohormesis happening.
Mm.
Add to that, like ergothioneine is probably one of my all-time favorites. It is most likely going to become a new vitamin. We've demonstrated that there's a deficiency for it. It results in mild cognitive impairment, to sometimes even advanced cognitive impairment. That there's a deficiency in that you cannot create it yourself endogenously. You need to find it exogenously. There's a unique transporter system for it in your body. You know how many like things there are like that? Like almost none. Like iron,
Yeah.
and it has a unique transporter system and storage system in your body for this nutrient. There's like the only thing that I can think of, which is probably one of the most critical nutrients to life, is iron. So
Mm.
that's really fascinating. And so that's exciting. And it's doing something like where it's not just a cellular antioxidant, but a mitochondrial antioxidant. And we see that cellular antioxidants have kind of equivocal data because it's complex, like the timing of oxidation reduction, and when you want something to be kind of pro-oxidative or anti-oxidative and signaling, and whether you want a cell to die at certain times or not. Think of cancer. It gets really complicated. But with the mitochondrial antioxidant, we're not seeing that complexity, and the
Mm.
body is using this antioxidant intelligently because of the storage and transport system. So it's a really exciting one. So that's probably one of my most exciting ingredients when it comes to mitochondrial health. And And I do love dihydroberberine. That's probably the first ingredient that I recommend because so many people are metabolically dysfunctional. And literally 9 out of 10 people, at least here in the US, are metabolically dysfunctional. That's going to lead
Mm.
to, like I said, faster biological aging, greater propensity for nearly all disease states, like that whole syndrome X cluster of diseases. So it's serious, and I think that's why we all need to take our metabolic health much more seriously.
Well, you mentioned, I mean, there's a few ingredients there, definitely. So ergothioneine, I mean, the level of impact that you have already had with that ingredient, but to be able to say that you've literally like pioneered an ingredient that is literally going to become a new vitamin, like that is just, it's just mind blowing, like the ability to achieve that. And then dihydroberberine, I mean, that's one that I've spoken about extensively as well on YouTube
Mm-hmm.
and my Instagram as a cutting edge GDA,
Mm-hmm.
glucose disposal agent that I think is just going to get stronger and stronger in terms of like awareness
Yeah,
over time. And
we're
my question
funding
to you will be,
we're funding about a $250,000 study on it right now that's going to have very robust results. So yeah, we're really
amazing.
excited about that one. The
Are
sales on
you
that have
allowed to?
just yeah.
Are you allowed to share like outcomes of the study that you're looking for at all?
Well, a big one is GLP-1, where we already know that it is the case, but we're going to show
Wow.
that pretty extensively, as well as the GLUT4 translocation extensively. Like because of the way it works, we already know this is the case because berberine converts to dihydroberberine, um, and ultimately like results in more berberine in plasma. Dihydroberberine converts back to berberine in plasma. So the way the whole thing works is whether you're taking berberine or dihydroberberine, it's going to result in berberine and plasma. You just get it to last a lot longer, less GI distress, much better bioavailability, much lower doses when it's dihydroberberine. But we still have to show that dihydroberberine does all these things itself. So we're proving that out, but we're looking at everything like inflammatory markers and cardiovascular markers and a lot of things as well as obviously improved insulin, improved blood glucose, um, you know, looking at body composition. Like we're looking at so many things.
And this is dose range 50 to 100 milligrams?
Uh, 100 and 150 will be the doses in it. Mm-hmm.
Awesome, man. Oh, geez, I can't wait for that. I cannot wait to be talking about that study when it's sounding like it's all going to be, it sounds like it will line up based upon the berberine literature. You guys would have been like, okay, this is what berberine has demonstrated.
Right.
So therefore dihydroberberine should theoretically also lead to even superior effects,
Exactly.
which is amazing. In terms of because this is a question that I know my audience is thinking of right now, which will be like, and I'm someone that, I try and educate on this as well, which is like you and I, we both take, probably a wide variety of supplements daily. In terms of the approach to like stacking or
Mm-hmm.
like building out a supplement stack,
Yeah.
what sort of guidelines do you like to share in that regard? Like, is there a particular cycling protocol? Like, do you take one day on, one day off? Like, how do you approach that?
I mean, first off, it's going to depend on obviously your physiology, your goals, and then this is often underappreciated is your compliance. Like, is that product something that you're going to stick with? Because it doesn't matter how good it is if you're not going to use it, right? So, I mean, it's absolutely critical. So if it's like too many capsules or a bad flavor or what it doesn't mix well and you just like don't use it enough, it doesn't matter. And certainly it's got to be from a quality company where the ingredients test out. This is a huge concern right now. If you've seen like the Now Foods test with Amazon, as much as 80% of the products they were looking at were not testing out. And I would say 20-30% didn't test out for any active at all. I
Of
mean, it was
of are these
of all the
single
different
ingredient?
ingredients, yes, of all the things that they were testing out, the numbers are shocking. And then there was a
Damn.
lot of counterfeiting of some of the big brands like Now Foods, like Thorne. There's a lot of counterfeiting going on. So, it's one of those things that I think it pays to make sure you're getting, one, a quality company, two, from a quality place. Like if you are going to get it on Amazon, try and get it from the company itself selling it on Amazon, ideally, or maybe like GNC or Vitamin Shop selling it on Amazon or something like that where you can trust the source. But right now, Amazon isn't exactly the most trusted source. But beyond that, I think you bring up a very good point, something I've thought through for years, is the idea of that you want to cycle through things so that you don't establish a baseline. Like with testosterone, when you take exogenous testosterone, your body stops making the endogenous testosterone. It sees the exogenous testosterone, testes don't need to make any more. We're like, hey, we're good.
Yep.
We got plenty. So, this is something that I think is really valid. And when I look at like, you can have metabolic inflexibility from having a high glycemic, high carb diet that's typical of a Western diet. You can have metabolic inflexibility from being really, really strict keto. This is the idea of like metabolic flexibility and cycling macronutrients. We also see this when your protein is super high all the time. You get into like these states where you're just oxidating protein and you're not really using it. And this is why we see, this idea of like rapamycin and mTOR inhibitors extending life. And then we're like, whoa, mTOR and protein is very important. Yes. So the key is like cycling to like protein fast and then high protein. And then you go the carb fasting and go high carb. You can do fat fasting and then high fat. Same with like these, when we look at senolytics, they're talking about maybe 3 to 5 days of like really hammering it, right? But not doing it consistently. Things like calcium AKG or some of the polyphenols. I think the same idea is true with all of these ingredients. With adaptogens, like I don't want to stay on one adaptogen forever. Like I like the idea of like, I'm going to use maca, I'm going to use rhodiola, I'm going to use ashwagandha, I'm going to whatever, like switching through them consistently so my body never builds up a tolerance of baseline. These guys that do the steroids, like they're going to do like pyramid up and pyramid down, right? It's this, all of this is the same idea. Like your receptors can get burnout when there's too much available. Your liver is going to like change its cytochrome P450 enzymes to start like putting the brakes on all these things coming in because it's too much. Like with these, there's too many nutrients to process. There's too many heavy metals and too many toxins, too many things coming in. And it's like, skirt, it's putting the brakes on it. All this stuff is happening. So if you want to do this intelligently, I really feel like this is where the idea of cycling all these things can come in.
And that's a principle that I think like it's easy to fall into the trap of just doing the shotgun method, which is just like throwing every single supplement down your body. I mean, the one guy, I mean, if we look at like Brian Johnson, I mean, he is calculated with his supplementation, but like practicality perspective, like how is that practical for 99% of the population, like?
Well, here's also what I don't like about that. So I was a chief clinical dietitian. Like I said, I work in nursing homes and hospitals. And we would have people that would have 7-10 pages of what's called MARS, the medical application record, like where you have like as many as 100 medications in these nursing homes on the med cart, right? And so we have these like drug nutrient interaction guides and drug interaction guides and whatever. And we know what like maybe one drug would do with one vitamin or mineral, or what maybe two of the most popular drugs might do. Like, let's say it's, Lasix or warfarin, or, some of these things, what they might do with one other popular drug. We have no idea. It's called polypharmacy, what 100 different drugs are doing in the body. No one knows that. There's no way to calculate that. The level of interactions are in the millions to billions. So we have no idea. And so when you're doing that many things, some of those things might be productive, some of those things might not be. I was mentioning cytochrome P450 and like P-glycoprotein. When I look at these enzymes, there's a lot of, like, by the way, berberine, affects that. Curcumin affects that. Quercetin affects that. A lot of these things affect that. So you don't know, like, what your doses in effect actually are. And then if you're taking it around like a fatty meal versus fasted, if you like are eating kind of one meal a day and you have slow GI transit, there's so many factors. Like, this is where you need to be in tune with your body. You need to think about your goals. And I like the scientific method of doing one thing at a time, seeing if it works for you, and then moving on to the next thing. Like, just going from out of the blue to 100 things out of zero. Like, you went from 0 to 100, like Drake. You're going 0 to 100 real quick. Like, what are you going to end up with? How are you judging that? What's work? Like what if you have to like cut half of those things? What are you cutting? How do you know what's working? How do you know what works for you? Just because it worked for someone else, you're just going to assume it works for you? I mean, caffeine doesn't work for me. There's a lot of things that don't work for me.
I definitely think that's an important principle, because a number of guys that have sort of approached me and they're just sending me their list of supplement stacks that they're taking. I'm like, like, how long have you been on vitamin B6 for? And he's like, oh, months. And it's like, okay, but also about the cautions, right? Because then things can
and
actually
the toxicity,
like things can start to build up in the body and actually potentially lead to adverse health outcomes, like literally worsening their health.
Do you know why that happens with B6? Because it's not the actual form of B6 endogenous to the body, the pyridoxal 5-phosphate. If you give pyridoxal 5-phosphate, there isn't that toxicity. What happens is pyridoxine ends up blocking at the receptor the actual vitamin that is supposed to be there. So, like, you can't, that's the problem when you take like these, high doses of especially these inferior forms of vitamins. If anyone's taking like that brings me to that point. If you're going to take vitamins, take especially B vitamins, methylated, coenzymated, active form B vitamins. Please, like, take those.
Be willing to spend the extra $10 on a bottle that's going to yield much more like favorable effects on your physiology. I think like to bargain hunt when it comes to like selecting, it's just it's the same thing with nutrition, right? Like you don't want to feed yourself poor quality food. You got to apply the same like rationale and thinking to supplementation.
Yeah. You don't want like Hot Pockets and Pop-Tarts. Like, you want like legit food, right? What
is your like, because I'd imagine, like you said before, you raised a really good point, Shawn, which was like the metabolic flexibility, being able to shift from like low carb, high fat, low fat, like rotating and actually experientially seeing the effects of those different approaches. But like, what's your approach now, like personally with your own nutrition?
From being 25 years into using the ketogenic diet, I've found that one, it got me out of being very unhealthy and metabolically dysfunctional. But two, I've loved like some of the brain function research that I've seen, some of the anti-aging research I've seen, helping to reverse TBIs, I certainly love that feeling. Like when I'm deep in ketosis, I feel like just my brain is just bam. I mean, like clicking, like whether you're fasting, whether it's ketogenic diet, whether you're doing glycogen depletive exercise, MCTs, like taking exogenous ketones, whatever your kind of method is. I do love that, but I've also created a metabolic flexibility where I do cyclical targeted ketogenic dieting. And then, if I'm traveling, uh, in Italy, I'm going to be the entire time I'm there, I'm going to be, high
Yeah.
carb. I'm going to enjoy it, like, because I've earned it. And I also think, like, whenever I do, like really exhaustive exercise and I'm very active, I always like weigh up my carbs, like, because I can do whatever I want on those days. Like I'm just throwing, you're a furnace and you can throw anything in that furnace and it'll burn. The problem is when you're more sedentary, like when I'm traveling and I'm on planes and trains and cars and hotels and events, and when I'm more sedentary, it's not a furnace. It's like an ember. And so I need to be more careful. And that's when I drop my carbs. I really feel like carbs are something that you earn through exercise. And so if you're highly active, have a bunch of carbs. If you're very sedentary, the last thing you want to do is carbs, especially high glycemic carbs.
Yeah, fully resonate with that. And just yesterday, I was looking into the effects, like the afterburn effects of jumping onto an assault bike. Those
Oh,
or
yes, those are the best. Yes, I love that too, like a Wingate bike or assault bike. Yeah, I've done that many times, and those things are. I mean, yeah, you want
oh
to talk
man,
about burning through glycogen and getting like, look, if you want like true hormesis, if you want
mm,
massive change, you will not get it with low intensity steady state. You start to approach it with high intensity interval training. You want massive change, it has to be at 99.98% of your maximum, whatever that is. And there was a
yeah,
great book I read from a Navy SEAL. I forget whether it was Jocko or one of those guys, but he talked about that there's 40% more in the tank. Our brain, our psychology for survival. It's like when you're exhausted and you're swimming out in the ocean, your brain is saving a reserve, saying like, we're done, we're exhausted. It's got 40% more in the tank. Now, I'm not talking about, you doing something where, you do something truly dangerous, like some of the CrossFitters have done in the past, where literally your muscle is dying. You don't want to get into that situation, but we certainly have way more to give than we're giving. And when we think we're exhausted, we're not. When we think we're hungry, we're probably really not. Like we could just have some water, some salt, and you'd be good. It's those kinds of things where, uh, you know, I think like if you want hormesis, which ultimately will result in higher sirtuin genes and their activation and greater longevity and resilience, this is how you do it by depriving yourself in the right way. Obviously, you don't want to do it too much, but in the right way. This is where cold plunges and hot saunas and fasting and cyclical ketogenic diets and whatever, all this stuff is going to create greater resilience for you.
Hmm. What do you think, Shawn, is going to be in terms of the supplementation space? Because I know you're like well across things in that area. In terms of that supplementation space, like what do you think is going to be the future of supplementation? Like, is it going to be weird delivery methods? Is it going to be like topicals? Is it going to like what do you think is going to be the future of supplementation?
Yeah, that's a great question. So as far as categories right now, what I'm seeing trending, I'll get to some kind of more theoretical stuff, but GLP-1s, whether
Mm.
it's like things like dihydroberberine or things to support them, because you're hearing about concurrent muscle loss, so that's where dialeucine actually comes in handy, or HMB, or some of these other ingredients. Some people are dehydrated, so electrolytes are coming in. Some people are deficient in certain nutrients because they're not eating as much, so maybe multivitamins. There's like kind of like a whole circle that's like around GLP-1 right now. That's really interesting. So that's a trend. I think symbiotics are a trend. I mean, it may sound cliche to those of us in the know that like the gut-brain axis, but there's leaky gut, there's leaky brain. There's the gut and the brain were together when we were, embryonic. Like it really is like 80% of your neurotransmitters are in the gut. 80% of your immunity is in the gut. Like we're learning so much about all this, and I believe that these symbiotics, where you have pre, pro, and post biotics, and then looking at the short chain fatty acid makeup in your gut might be just as important, if not more important, than actually looking at the bacterial makeup in your gut. There's a lot there. There's so much there. Like we're just at the start of it. Like psychobiotics is the idea of, having like the cognitive enhancement or kind of mood changes related to your gut microbiome. So those are some big areas. I definitely think personalized nutrition is huge. Executing that right now is difficult. I do worry about going back to what we were talking about before. This is one problem that I see with it. So my friends that were type 1 diabetics that have a closed loop system have an insulin pump on their hip. And when the insulin is low, insulin comes into their body and, can address the elevated blood glucose. And so it's a closed loop system. Now, what if we have something like this as a wearable that's sensing, this is not far off, like, I have an Oura Ring and they're already filing patents around blood pressure, filing patents around blood glucose, wow. EEG, the whole thing. I mean, these things are going to get so advanced so quickly. It will be looking at like your vitamin mineral status at some of these important markers. And then what if it's just releasing certain amounts of these vitamins or minerals as you need it? Guess what's going to happen? We are going to lack resilience. Like right now, we're thermically controlled where we're at. I'm trying to think of what it is. What's room temperature for you?
18 degrees, maybe.
18 degrees. So like in the US, it's like 67, something like that. And so we're literally in that temperature all day, every day, whether we're in our car, in our office, in our house, like wherever we are. Like we're not in extreme cold, extreme heat. We're not dealing with this and becoming strong and resilient. We're becoming weak. And this is why COVID-19 can wipe us out. And it's like a laughable virus, to be honest. Like, like these guys, the Vikings would have freaking laughed at that. Like, but because we're like so in our little boxes eating garbage crap and we're breathing garbage air, like under garbage light, and we're getting poor sleep and we've got our Apple, vision goggles on and we're circadian rhythms completely effed up and we don't get hugs and we don't interact with people on a real level, we're completely screwed. And we are weak. We are fragile. We lack resilience. We are easy to kill. And this is a huge problem that I could see happening with personalized nutrition. It's like this is where we need to think about, I think, orthomolecular dosing and then depriving. And then, like playing with peaks and troughs. Just like I'm saying with, when we're doing this with fasting and then one meal a day, right? Like it's like you're going 0, 0, 0, 0, and then 2,000 calories, 3,000 calories, boom, and then 0, right? Like, and that used to be a common way to eat. It wasn't called fasting before, it was called starving. It was like we didn't have like this omnipresent food everywhere and vending machines and Grubhub and Uber Eats and, like whatever, like whole cabinets full of stuff. And no, like you had to go find food. You had to work for it. You had to hunt it, like, you know? So this is what I worry about with the personalized nutrition. I think lastly, you bring up a good point on delivery. I mean, we are certainly looking at nanomolecular, at liposomal. I've been working on different peptides and signaling. Uh, but yeah, like topical, like transdermal, super interesting. Sublingual, also called buccal absorption, intranasal. We're seeing a lot of different delivery systems. It's a great point. So I think there's a huge future in front of us with all of that. And each of them are
Mm.
going to have different pharmacokinetics and pharmacodynamics where the whole thing's going to be very unique, and it needs to be explored.
I'm very excited. I'm very, very excited to see all of those areas develop and grow. Like, I mean, the psychobiotic space, the personalized nutrition. I mean, that's exciting. I was thinking of a video idea. I became iron deficient, so you don't have to. It's like make a video on that topic. That'd be so
Well,
funny.
that's funny you bring that up. So iron. So one of the reasons that women live a lot longer than men, and trust me, I worked in a
Mm.
nursing home and I saw this. One of the biggest reasons, and women may dread the fact that they have their menstrual cycle, the period, but they are dumping iron. Iron is toxic. Iron builds up, and it's highly oxidative. And they've shown that men that give blood 2 to 4 times a year live 3 years longer. That is a massive, massive number. That's across the board, irrespective of diet, of all the other things. 3 years longer if you just give blood.
Mm.
This has led to people using leeches, like literally like cutting, like doing cutting in the showers. And like you've seen crazy stuff. You've seen some of the hardcore biohackers. They call it bloodletting. But like that's what that is. Like, and it's definitely something. So I'd encourage you, it's a win-win for you men out there to give blood. And especially if you're using exogenous testosterone, TRT, and especially if you're using kind of more supraphysiologic doses, like a lot of men are using. They're like not just going with kind of like normophysiologic, they're going big. You're going to build up hemoglobin, hematocrit. You're going to build up high levels of iron, and it becomes toxic. And then you're going to have elevated heart rate, high blood pressure. You're going to be red in the face. You see these guys, right, at the gym. This is what's happening. And then you're a second away from a stroke or a heart attack. You got to dump that iron. Really important.
Mm-hmm. I just donated blood 3 weeks ago, and I'll be doing it every 6 months. I try and do that. But
perfect.
Yeah, it's such a simple intervention that can not only benefit the receiver, but also, benefit yourself.
So that's actually an idea that I had in my book. The energy formula is this idea called biohacktivism, where I had the mashups of like hacktivism is the idea of like Julian Assange or Edward Snowden, like where they're hacking for the social good, right? And then biohacking, that mashup of hacking your biology to like elicit like a greater effect in performance or longevity. And so biohacktivism is like when you're hacking your own health so that you're optimized so that you can make a greater impact on the world around you. When we're exhausted, when we're in poor health, we're heads down, we're not going to make much of an impact, whether it's in our jobs or just seeing other people, connecting with other people, feeling their pain, helping them out. Like that's the idea, is like we can make greater impact when we're healthier.
Shawn, my final question to you is around impact. I mean, you have already left a huge mark in the supplementation space, health optimization space. What further impact are you looking to make in this space, and how are you wanting to achieve that?
Yeah, right now, for me, like everything feels like legacy, and it just shifted like a year ago, maybe. again, I think when I got comfortable in this kind of plant medicine space and I started really feeling like I'm at the top of my career, I'm at the peak, and it's not to say anyone else can't come there too. Like, absolutely, come along, like, be your best. But like, I've really achieved the highest level of achievement in my field. And so now, like, I'm thinking about like my legacy, my impact to the world, my love letter to the world, and like how I can impact the health of the world and how I can, like, the mark that I'm leaving. It's less about money and accolades and being on Joe Rogan or whatever. That'd be cool if I was, but whatever that is, like, I feel less of a pull towards those things. And now I'm like working on that lasting mark. Like, I want to, like, have the rings in the pond. I want to have the butterfly effect. Like, and I'm thinking about, like, yeah, my legacy to the world. And that's really become incredibly important to me. Like, I've made a huge shift in my soul on that front.
Man, keep doing what you're doing. And yeah, I want to personally say thank you so much for all of the help that you've offered me, like, entirely for free and just out of pure generosity over the years. Because, like, you have inspired me. You, without realizing, you have, like, pushed me on the path that I know I'm like capable of achieving so much in. And I feel like I'm only just scraping my potential, and I can't wait to see where I go in the next 10 to 15 years from now, having all of the knowledge that you've passed on.
I can't wait to see it either, because like, I wish I had that. That's kind of like the Roger Bannister idea, like with the 4 minute mile. Like, once he did it, like, tons of people broke it. It's like having someone that you can see in front of you do something makes it all so much easier when you can see it and know that it's achievable. It's so helpful, and I can just imagine, like, all the people that you're inspiring. There's got to be tons of people that you're inspiring right now that are following you, that are like, man, I want to be Lucas. Like, I'm gonna be there someday. And because they're seeing you, it's happening. So I love that too, man. And my legacy is people like you. Like, that's how I continue to make impact, is not just talking to people and improving health and them taking my supplements, but hopefully inspiring other people to follow in my footsteps and one up me. I want other people out there to, it's like, you're standing on the shoulders of giants, right? Like, I'm one of these giants right now. You're standing on my shoulders. You're going to outdo me. And then there's going to be people come along that stand on your shoulders. And that's how we move things forward.
It's incredible. Incredible. So, Shawn, if my audience wants to connect with you, follow you, where can they find you?
Yeah, so at Shawn Wells, ShawnWells, ShawnWells.com. If you want to formulate with me, ZoneHalo.com. My ingenious ingredients is my intellectual property side. NNB is ingredients that I've helped create and put out, one of the places. And but yeah, I'd say largely just connect with me at Shawn Wells, and I answer my DMs, and I'm here to help in any way I can.
Awesome. I'll make sure to leave those linked in the podcast show notes. But otherwise, Shawn, thank you so much for coming on the podcast.
Oh, yeah. Last thing, energyformula.com. Go there, read the book. I've got Audible, ebook, hardcover, softback. You go to energyformula.com, you get a bunch of extras. I got a course coming out on it soon. I've also got a really cool course coming out with Mind Valley soon on supplements. So a lot of stuff coming. Thanks, brother.
Amazing. Awesome stuff. Thanks so much, Shawn. We'll be in touch.
All right. See you, brother.